are done on the patient. A couple other uses, deterioration index is another AI that pulls in a lot of documentation inside the chart to tell us how the patient's doing, and do we see the patient begin to deteriorate, to say, well, we might need to check in. Rapid response might need a round on the patient, see what's going on with the patient. Again, you can hover, it will tell you exactly what's scoring out the patient to tell you why they're deteriorating. And where we've really been able to use it with the virtual nurses is we have small regional hospitals inside of our 12 hospital system that don't have rapid response nurses. So now the virtual nurse can be the rapid response nurse, camera into the room, check in on the patient, get the nurse at the bedside if they need to come into the room to see if there's something that they need to do for the patient, or is it scoring appropriately, but the patient's really not deteriorating. It's really just their baseline. But the biggest success we've had probably with AI, there's no way I can not talk about our discharge project. And I talked about it last year a little bit. So we have a system that helps us identify likely to go home patients. So today it will be telling us who's going to go home tomorrow, who should go home tomorrow by looking inside of all the data. It will tell us that, and it is 85% accurate on identifying patients that will go home, and will go home with no needs. Like, we don't need home health. We don't need to wait on the nursing home for 15 days to actually take the patient. The patient can actually get out of the building. And it will also tell us, well, Dr. Jones hasn't ordered these 4 tests that he normally orders, and we need to go ahead and get those ordered today so we can go home tomorrow. So it will tell us any care gaps that we haven't fulfilled off of ordering patterns of the physician. So from the work we've done around that, we've been able to move our discharges by 10:30 to 35% leave out of our building by 10:30 in the morning. We have a 79-minute from the time the order goes into the patient pushes out the door, 79 minutes for us to do that. And so we've obviously decreased our boarders in the ER by about 500 every month inside of our ERs. And what it really has done for us is it's given us the equivalent of 34 beds across our campus that are not staffed, that it's just 34 new beds by getting patients out quicker and to be more accurate with length of stay. That we've been able to take more transfer. So we're up 24% on transfer volume that we've been able to take into the system. And that's from the analytics that's running behind the scenes to tell us who's going to go home. So
what I like about every one of the examples that you shared is that it's augmenting humans being able to do things better.
Right.
And I think that's the world we'll live in for quite a while. Because I think that the AI today is really good at helping us see things we couldn't through many calculations, etc. But most everything you shared still needs a human to do something to make it happen. I had an opportunity 10 years ago to build a employee turnover. I was just using linear regression and some tools that were certainly not as advanced as they are today. And it can predict at about a 60% accuracy employees who are going to leave in the next 90 days that we're going to leave. So, but it was a black box situation. It didn't put out a lot of why. And so it was cool to do. But then my first question, as soon as we got it to go, was like, what are you going to do with this? You don't go to the employee and say, hey, you showed up on this list, please don't, please. And so we had to, in this pilot, we'd provide the list to leaders, HR leaders, that could then work with their operational leaders, but instead say, hey, we haven't had lunch, Kathy. Let's have lunch and talk about how things are going, or whatever. And so it's that same example. It helps people integrate AI.